Hi y'all, and welcome back to my channel. Today I'm going to guide you on how to look for a work from home position as a nurse. Indeed. So let's look in, let's say, Los Angeles, California. We're going to type remote work from home nursing position. Yeah. Okay. So here we see RN Home Clinical Care Coordinator. It has an email to apply to. We're going to scroll right down to the qualifications. Let's get to the nitty-gritty. You can read a little bit about the responsibilities and things of that nature. A clinical care coordinator, I'm not sure what they do, but yeah, this looks like maybe a temp agency, which can be great if you still plan to work at a bedside position as a nurse, or if you are trying to be overemployed. Overemployment meaning you're working from home and you have more than one job. Temp jobs can be awesome as well to give you that extra income and know that it's going to end. You need a current active and unrestricted nursing license, a minimum of 3 years of acute care clinical experience or public health nursing required, and a minimum of 2 years, but minimum of 2 years of managed care experience in case management with a focus in inpatient or outpatient ambulatory care preferred. So if this fits you, that would be great. It would be one of the ones to apply for. RN call center, this is also remote. If you enjoy customer service positions and you don't mind being on the phone for most of your workday, then this would be the position for you. RNs also work in call centers to help answer some of those questions from patients that have something going on with them and they don't really know if they should go to ER or ED or go to the urgent care center. So here's the wage. This one looks good. Need your ACLS and PALS, plus 2 years working as a registered nurse, preferably in ER, critical care, pediatrics, or med surg. Let's see. This is United Health Group. All employees working remotely will be required to adhere to United Health Group's telecommuter policy. Need your bachelor's of science. And these are, again, preferred qualifications. This doesn't mean that you have to have them, but it would possibly give you a leg up if you did. These are the required. Okay, graduation from an accredited school of nursing. You need an active nursing license, your BLS, emergency severity index certification within 30 days of hire. So it doesn't mean that you have to have it when you are hired, but within 30 days when you are hired. Okay, so this doesn't even say that you need your BSN. They would consider you if you had an ADN, but they prefer your BSN. So this one would possibly be a good one if you're interested in this pay range. Optum California is seeking a RN call center nurse to join our team in Torrance, California. It's a clinician-led care organization that is changing the way clinicians work and live. So looks like they are wanting a team that is remote. Okay, that one would be a good one. Home infusion intake authorization specialist. So this would possibly be prior authorization. Is it remote though? So the key here is to type in remote or work from home or both, and type in your area that you live in or that you prefer to have the position located in. Now, some of these can be United States wide or wherever you live countrywide, and you don't have to be pigeonholed to one area. But a lot of these are, you must live within this city. The ones that I have dealt with, they don't, like the job that I work at now, they don't care where you live as long as you live in California. So we have nurses in Southern California, Central California, and Northern California. We come from everywhere. This one prefers that you have some claims coding. So if you have some medical claims coding experience, you'd be a shoo-in for this one. Wound care, remote. How does that happen? Let's see. Medical terminology, of course, if you're a nurse, you most likely have medical terminology. 5 or more years experience in clinical operations. This is required. Okay. Now let's look for remote. This is generalization. If you do not just want a UM or utilization management position, then just put remote work from home nursing positions. Remote UM nursing positions. And also see, I put within 25 miles. Let's get out of that. Can I? Let's say within 100 miles, eh? UM medical management. Looks like good pay. Direct hire, location, remote, preferably California residents or PST or Mountain Standard Time Zone states. So this one is not just California, but you must have a California state license unrestricted. So you can live in your Mountain Standard Time zones, but you must have a California state license that's unrestricted. Bachelor's degree in nursing, 6 years of clinical nursing experience, 4 years of leadership, supervisor manager experience, solid knowledge of approval and denial letters. This one is a little bit stricter, and for those nurses that have been in UM or supervisor, supervisory or management positions, so lead or manager or supervisor at a job, and a total of 6 years at least. Central denials. Let's look at this one. It might be an appeals nurse. So again, this is Optum. It says graduation from an accredited licensed vocational nurse program. So if you're an LVN, this one's for you. At least, current LVN license in California. 1+ years of experience as a UM nurse reviewer. 1+ years of recent clinical experience working as an LVN or an LPN. Preferred, though, they want you to have your bachelor's degree in nursing. So I'm guessing that would be registered nurse. 3+ years of managed care utilization. 1+ years of experience performing essential functions of a CDU nurse. I don't know what a CDU nurse is, but I'm guessing central denials UM nurse. This is an LVN position. So you see, there's not just registered nurses that can work from home. There are also LVNs. We had an LVN at my job, and then she retired. She was working there for quite a long time, and I think that was the last LVN we hired. But there is a pay differential for California residents only. So these positions are out there. In fact, I found the position that I'm at on Indeed.com, but Indeed can be kind of janky. I applied for another job, for an authorization job, and it was weird. They asked me to send my resume to them, which I did, and then they set up an interview with me, not even letting me know what time the interview would be, right? And then the very next day, when I wake up at 7 o'clock, I saw that I had a text message at 6:30 a.m. California time saying, "Are you ready for the interview?" And I was like, "No, I'm not ready for the interview." It was like, "Well, we were waiting for you in the interview." I'm like, "Bruh, you didn't notify me of when I was supposed to jump on this call for the interview." So, I'm okay. I'm not going to apply. It was like, "We can reschedule." I'm like, "No, this was messy in the first place, and I'm probably not going to enjoy working here." So, yeah, there's chronic care management, LVN, case management. Here you go. Per diem staff nurse. That's not what we are looking for, but here's one. This is grievances and appeals, UM nurse. Gold Coast Health Plan. So some of these health plans, like the one that I currently work for, I don't work for Gold Coast, but they can post their positions on Indeed, or you can go straight to their website, to their career section. If you can, first go to the health plan's career section on their website, because I just feel like it's more legit. But if you're looking for more of a pool, if you're not particular of what companies you want to be applying for, then Indeed is a really good resource. Just make sure you vet the post and look out for anything that's janky, like a Gmail. Send your email to this Gmail. Like, no, I'm not sending you. That's not professional. You know what I mean? I'm not sending you my information through that. RN utilization. Let's see. Utilization management, grievances, and appeals. As I stated before, I was an appeal nurse. So the unit was grievances and appeals for that particular insurance company. Gives you a little breakdown. Pay attention to the position summary and make sure that you are able to do most of the things in the essential functions. If you've never worked for a UM position and you've always been a bedside nurse, some of this is not going to make sense to you. Just do your research, plug it into Google, get more into what it can mean and what it can entail. As I mentioned before, they utilize MCG online criteria to figure out if they deny a service or can approve a service. MCG is a long list of medical criteria that gives you an idea of what you can approve, what medical conditions the patient has that can be approvable for admission to a hospital or, a prolonged stay or admission to a long-term care or rehab facility. Physician qualifications. These are your competencies right here, skills and abilities. They want you to have a bachelor's degree preferred. But again, if you have your ADN, apply. I am a person that's very positive. I don't care. If it says preferred, that doesn't mean you're automatically out. Apply. And you never know what could happen because some of these companies may not have the applicants that they're looking for. My current job that I worked in, once that nurse retired, they literally had that position open for 2 months She retired in August and they just hired someone in December because they were looking for people and some people weren't even applying. They were asking us left and right, do you know anybody? Do you know anybody? Please have them apply. Because some of these positions, there aren't nurses applying. A lot of bedside nurses don't even know you can work from home. So apply anyway. You just never know. So the experience they want, case management and our utilization review experience preferred. Again, doesn't mean you have to have it because a lot of this stuff, if not all of it, can be trainable. I have a background in claims before I even became a nurse when I was like 21 to 24 years old. And do I need it for this job? No, but it does help because I have Medi-Cal, which is California's Medicaid program. I have experience with that. That's all it looks like. It just looks good on a resume. Other requirements: effectively apply acute care medical surgical nursing practices, use clinical guidelines for medical necessity. If you can read, basically, you can get it. Demonstrated ability to problem solve complex, multifaceted, emotionally charged situations. There's rarely any, from our part, it's not like you are taking care of a patient that could possibly start to decline rapidly. This is emotionally charged as in they really need these authorizations to get a service approved so they can continue with whatever, diagnostics, testing, or service that the patient needs or wants. So that's emotionally charged. They don't like to hear that it is obviously denied. So that's the emotionally charged thing. And in the position that I was in, we only had to call the member if something was denied and it was sent to us by the state. Any other time when something was denied, we as nurses did not have to make a phone call. So here are your requirements right here. Other requirements: certifications that you need. You need computer skills. Please make sure that you are computer savvy because there will be times where you need to troubleshoot. Your computer will mess up. Programs will not work. If you know how to reboot and restart and clear your cache in your browsers, you're golden. Okay, everything else you can link up with the IT department of whatever company that you work for, and they'll be able to remotely fix whatever problem you have. And utilize Teams, Microsoft Teams. Okay. Now, let's say you are straight from bedside, you don't know none of this. So let's go over. In California, it is dhcs.ca.gov. Now, let's say this is managed care. Managed care meaning managed by the state. So there's money that the state gets from the federal government to run Medicaid programs. So for our state in California, it's DHCS, which I so happen to work for before I became a nurse. And they give you funding to run those programs for lower income individuals that need healthcare. So all you have to do, go to your state's managed Medicaid program and read up on it. There's a lot of reading, but familiarize yourself with some of the things. So in California, they have different health plans, right? Say you're applying for a Medicaid position or a managed care position. So grievances and appeals in a Medicaid program, in a Medicaid department at some insurance company. There are a few insurance companies that contract with DHCS, and I can't tell you, maybe there's about 20 health plans. So like Kaiser's one of them. They have a Medicaid side. They have commercial insurance, but they also have a Medicaid side. Anthem is one of them. They have commercial insurance, but they also have a Medicaid side. So they are considered a managed care plan, right? Because they have to contract with the state of California, which is the Department of Healthcare Services, for the Medicaid side. So they have contractual obligations to meet, and DHCS will oversee that Medicaid side. So every now and then, each health plan has to report to DHCS on an annual basis, I believe, to ensure that they are meeting certain metrics. And DHCS will let them know when they are failing to meet those metrics. I know because I was in that unit that oversaw the contract between managed care plans and the state. So just familiarize yourself on managed care organization things if you are going for something that is in a managed care health plan. If you're going for a position in a managed care health plan, okay? And you have no experience or experience with Medicaid, you want to sell yourself. I love these fact sheets. You want to sell yourself on what you know about Medicaid. That's your best bet. If you have no experience and you get the interview anyway, sell yourself on that managed care knowledge. So familiarize yourself with your state's Medicaid website and read up on it. Okay, here's a county map. This tells you the regions or what model is employed in each of the counties of California. There should also be another map that shows you what health plans are available. Let me see if I can find it. So I don't see. So look, some Medi-Cal members in 21 counties may need to change to a new health plan, blah, blah, blah. Okay, let's type in a county. Los Angeles. And it'll tell you all the health plans available. So these are managed care plans available in that county. Type in your county if you're in California, or I hope your state has a department and their Medicaid website like we do in California that will let you type in whatever county that you live in and then gives you a list of managed care plans. Or you can just go to whatever insurance company that you know of, their website, and apply for those types of positions that are mentioned here. Look for these types: utilization management, grievance and appeals, prior authorization, case management, if you have enough experience. Most of the time, case management will probably need 5 years, but once again, I'm optimistic. Just look at it and see what it is that they require, because different positions require different things. It's not that all of these insurance companies have the same criteria to hire you. Okay. So yeah, as I mentioned before, type it in, you'll get a list of managed care plans, and you can apply for the Medicaid side of things. Go straight to their website and look for that. Look for those positions that I just mentioned. See, here's one qualification, clinical reviewer, and most likely that's like a nurse. You have an associate's degree or diploma, that's required, registered nurse, or an LPN. Based on allowable state practice act. You hold an active, current, and unrestricted license. You have a minimum of 1 to 2 years prior auth experience or a Medicare or Medicare Advantage home health required. You have a minimum of 2 years in a clinical setting. You have 1 to 2 years experience in interqual. Some insurance companies use MCG or interqual. You hold a broad knowledge of healthcare delivery, managed care regulations. Here's where that importance of reading up on the commercial insurance you're applying for or the Medicaid program's website is. Full range of here's the benefits. That's good. You possess proficient analytical, blah, blah, blah. So if you don't have the UM or prior auth experience going on for you and you manage to get that interview, please do bring up some of your knowledge. Hills physician, prior auth nurse, may consider hiring for this role remotely. Some of them and a lot of them have gone to hybrid, where you come into the office at least 2 days per week. I prefer to be fully remote. Appeals and grievances clinical specialist, RN or LPN. Appeals nurse consultant, CVS. You know, they're out there. You just have to look, okay? So hopefully you found this video helpful. Elevance Health. Ugh. Okay. Just go straight to the career section. And sometimes you have to look. It'll be under the who we are or about us section, or if you don't find it immediately. Explore our careers. Keyword, nurse. Location, type in a location if you'd like. If you're pretty open, want to see what's going on here. There you go. Look, nurse appeals, nurse reviewer. This position will work in a hybrid model, remote and office. It gives you all the things that you will do. Requires a minimum of 2 years of experience on a managed care healthcare setting, or, and this is what I love, any combination of education and experience which will provide an equivalent background. So they would like for you to have managed care healthcare experience, but they're okay if you don't. If you have some other experience, a combination of education and experience that would provide an equivalent background, they're okay with it, okay? The most important thing is to have an unrestricted nursing license. Apply, apply, apply. And here, they don't care. AS or BS is preferred, which is also ADN or BSN, okay? Just in case you were confused about that. How do I know? I was a lead in one of the appeals and grievances team, the appeals team at Elevance Health, and we do not care about ADN or BSN or ASN, whatever you want to call it. And I also was on the panel for several interviews as a lead. So hopefully you found this video helpful.